Hello, today we'll be performing an indirect cannulation technique used for venous arterial ECMO. This is an indirect technique, meaning we'll be using a graft. A direct technique would not use a graft and would typically be seen for life-saving procedures. Additionally, we'll be entering through the axillary artery today. There are multiple ways we can get into the arterial system. This method we chose uses the axillary artery. Before we begin showing you the procedure, we're going to show you some of the anatomy of the shirt that we created. To begin on the shirt, we have the manubrium with the sternum removed so that you could see the heart. Next, we have the clavicle with the first 5 ribs shown so you can see the pec minor here in yellow. Pec minor goes up to a portion that is labeled number 2. That'll be discussed later. What's important to note is the number 1 segment with the small black mark along where the artery is. And that'll be discussed later as well. Additionally, on the heart, we have all the associated vasculature that'll be used for this procedure to include the aorta, subclavian turning into axillary, 2 carotids for a reference, and then lastly, the femoral vein. To begin the procedure, an incision is made in the right infraclavicular region parallel to the clavicle. Right here. Right? I showed you that line where the incision is made. All dermal layers are incised along with adipose tissue. There are no muscles cut in this procedure for the technique that we used, which involves the axillary artery. Next, the axillary vein is dissected out, isolated, and clipped. Following that, the axillary artery is dissected out. Now, before anything happens after that, heparin is provided, which we have our heparin here, and our anesthesiologist would apply it into what is already attached for their medications. So once the heparin is put in, you wait for the effects. So we are trying to prevent blood clots, and then we would clip the artery. There are 3 segments of the axillary artery. The first segment located between the first rib, right here, and the pec minor, right here. So that first segment that I showed you in the beginning with the small mark, that is the part of the axillary artery that will be accessed for this procedure. The first segment is cut and extended with scissors. Following this, a gel weave graft is sewn into the axillary artery, incorporating a strip of soft felt. So I have a strip of soft felt here so you can see for reference. And what this does is it bolsters the suture so that the suture isn't just from artery to graft, but it also has a little bit of felt to grab onto that makes it that much stronger. There we go. All right, so once the graft is sutured on with the felt to the artery, the graft is trimmed, the cannula tube is inserted and held down with ties. So one thing that I want to mention really quick is the graft is trimmed to about the level of the dermis layer, the dermal layer that is. So you would see the graft poking out of this incision, and then it would abruptly stop, and then the tube would be replacing what continues to the ECMO machine. So, with that being said, we have our tube here that I'm going to attach to our felt and our graft. All right. Next, Doppler ultrasound is used to locate the femoral vein. This is also helpful when you know your anatomy, going nerve, artery, vein from lateral to medial. Following that, a needle is used to enter the femoral artery. Once the needle is in the femoral artery, a wire is used to dilate the vessel. So, have a prop wire here, which will, as mentioned, go into the femoral artery all the way up to just about the inferior vena cava there. And that's how. So the wire is staying in place. Next, an incision is made, and it makes the entry wider so we can enter a tube. And that tube is going to be inserted all the way following the wire to the middle of the right atrium. So here's our tube, and I'll be inserting that tube with the wire inside. I'm going to borrow that. Oh, it's all the way up to the right atrium. So right there. Once that is made, I will be clipping it in place. That's my shirt. From there, the wire is then removed. And following that, staples and sutures are used to close the surrounding tissues. The ECMO machine is turned on. There we go. And just for reference, the way this works, the deoxygenated blood is drawn from the femoral tube from the right atrium. It is then taken to the ECMO machine. The ECMO machine oxygenates that blood and then sends it back in to the axillary artery to be sent throughout systemically. And that is the indirect cannulation technique used for venous arterial ECMO.